What's up everyone, Dr. Tony Crone with Dr. Mark Hawkins here for Wellness Wednesday 34. We are going over dry needling today and what trigger points are. So you guys get to see me get dry needled today so you can kind of just see the process if you haven't had it done. If you've had it done, share it with friends so they know what they're missing out on because it works really well at relieving some of that muscle tension. So trigger points, they're just tight bands of tissue within the muscle that restricts range of motion and can elicit pain and also cause pain referral patterns. So sometimes if you come in with headaches, we may be addressing the headaches, but it could be coming from a trigger point, say in the trap-levator complex or somewhere along the chain. So we're scouring the body for these trigger points to see if it elicits or reproduces what you're coming in with, because then we're going to attack it that way rather than just chasing the pain that you have, because it could lead us down a completely different route. So we use a dry needle, an acupuncture needle to pierce the muscle to go in and cause an increase or a micro trauma to increase blood flow, to circulate everything out, decrease inflammation, and restore that muscle length. So for myself, I always have just upper tract problems that refer up into the jaw sometimes, and I sometimes get headaches with that as well. So we're gonna have Dr. Hawkins needle me, and hopefully we'll get a twitch response so you can see that effect with the needle going into the muscle. So come on the knee. So with this, obviously we're going to take sterile precautions. He's already done that by washing hands, cleaning the area, doing all the things necessary, and then we just let him go with the needle. So if he wants, he can kind of talk a little bit about what kind of needle he's using, how to find the trigger point, anything. Or if he doesn't want to talk at all, he doesn't have to.
No, absolutely. So like when we find that trigger point, usually it'll live in the band. And sometimes within that band of tight muscle, there'll be one specific spot that we really try to target. So like when we palpate Tony's neck here, first thing that I'll do is we'll come in and we'll just do a general palpation on his upper trap. And if we start to locate a particular knot, then I'll start to hone in and say, hey, this is exactly where I need to put the needle. So when we do that, then we'll say, all right, Doc, flip on your belly. So then I can turn him over. So we can actually, you guys can kind of see exactly where we're going to be. So for Dr. Crone, we're going to come right into that little guitar string band right there. So when we're in the office, we grab our alcohol, get little cotton balls, that way we can clean this area. And I'll clean the entire area even though I'm just going to use one small portion of it. And we scrub everything down to get nice and clean. And then here, these needles, even though each one comes individually wrapped, they're all sterile. We don't reuse them. So we'll come right back to where his trigger point was. And once we kind of get into it, sometimes we'll just kind of go along, boom, and try to go right to where that trigger point is. Sometimes we'll ask the patient, we'll be like, hey doc, do you feel that radiating up into your temple? Do you feel it into your jaw? Does it reproduce your headache? And those are great little nuggets for us because then it tells us whether or not we're in the right tissue, because there are a lot of different structures within the neck that radiate to the head. And so there is a little bit of overlap between those tissues. So sometimes we might find a trigger point, but it might be one of a couple different ones that are radiating. So it's good to know, hey, that totally reproduced my headache. If so, then we know, hey, we're totally in the right spot. And personally for me, and this is just a provider preference type of deal, but I prefer to needle the spot, and then I like to leave my patients and I just kind of let them hang out for anywhere from 5 to 8 minutes with the needles in, hopefully trying to improve that change that we're hoping for here. So, you doing good, Doc?
I am. I actually felt that one up in my jaw, so that was cool.
Sweet.
So we're not going to keep you any longer. I can't turn my head because that'll kind of tear a little bit. Don't want that. But if you have had dry needling before or ever want it, give us a call and we can help you out. See ya, everyone.
See ya.